Hey, what's going on, good people? It's your boy James Harris, of course, Mental Heal. Listen, I appreciate all the support over the years, whether it was for my book, man, Just Express Yourself, which is an interactive planning guide for boys and men to better express themselves. So salute to those parents who got it for their young sons. Praises to those partners and couples who got it for the men in their life. Of course, to the schools, the administrative, and everybody else who ordering the book by the dozens. I definitely appreciate that. And also salute to everybody who supported me on Cheesy Date Board Games, which is a good game for adults and couples, your game night, your date night. So many interactive ideas come from it. I definitely love the responses that it's garnering. But now I'm asking for your support again on this YouTube journey. I'm back. I took a little break because I had so much going on, but be a little bit more consistent with it. I got a couple interviews lined up with prominent people and people doing phenomenal things within the community or within this mental health space or even different authors and things like that. So bear with me. Appreciate your support. So make sure you like, share, and subscribe. And the guest that I got coming up now is.
My name is Dr. Bridget Callaham. I am a board certified family medicine physician. Um, Always had an interest in medicine, just took a non-traditional route to get there, but practicing family medicine outpatient in Richmond, Virginia. Love what I do, very focused on women's health. It's one of my passions.
Okay, so the journey of women's health is pretty much why I got you here because, of course, when women get to a certain age, they run into this beast called menopause. And I just want to ensure that I'm doing my due diligence and helping out the fellas on some ways that they can support, that lady in their lives on this journey because it's a lot, with the mood swings, the heart flashes, and so many other symptoms. I want to be able to say, hey fellas, check this out. These are some things that you can do for your partner or your mom or your sister or, pretty much any woman in your life. So I guess you can break it down, start there. What is menopause?
So menopause is the permanent cessation or stopping of the menstrual cycle. It is preceded by a period called perimenopause, which pretty much exhibits similar symptoms to menopause, except you still can have periods. It's just irregular periods. But once a woman has stopped having her periods for at least a year, then we are into the menopause phase of life.
Okay, so what are some symptoms of menopause?
Well, menopause can have the infamous hot flashes. You can have depression. You can have cognitive issues, which are just like brain fog, forgetfulness, difficulty finding like words. Um, and you can also have issues with sleep. One of the most common things that women talk about is because the estrogen starts to go down, they have low, like libido or low sex drive, and then they also have vaginal dryness.
Mm. Okay, so I guess those last few symptoms specifically would impact probably that relationship with that partner, and them not understanding and or not being able to, I guess, relay that to him,
Mhm.
so they can make the modifications or adjustment that they need to do. So how long does these symptoms last? Because if it is a situation to where, they were frequently having, sexual
Mhm.
engagement and now it's shifted and or just the brain fog. Like, how long can they expect for their partner to, be forgetful or be imbalanced based on the hormones or anything like that?
So it does vary from person to person, but the average is around like 7 years of symptoms like this.
Okay, so when I guess when is the onset age then?
So the average age of onset of menopause is around 51 years old.
Okay, so around 51, it can last to closer to 60, if anything.
Yeah, and of course that can vary if you are not taking certain steps to rectify the issues. Like for instance, if you're having the hot flashes, you can consider there are multiple treatments, changes to your lifestyle and your diet that you can try to implement that would decrease those symptoms that you're having.
Okay, I got you. So you talked on a couple of the body symptoms and things that women might experience, but is there anything specifically change-wise that I can do or any other male can do to assist our partner with these changes. I mean, it sounds obvious if somebody's having a heart flash to, hey, you want me to cut the fan on? You want me to get you a popsicle, icy or something? Or like, what are some other things that we can do?
Okay, I think the biggest thing is for men to just be educated on what menopause is in general. And then from there, being able to communicate with your partner about what they are experiencing. And of course, that that has to go both ways, just like the man has to ask about what's going on. The woman has to be open with telling you what she's going through, what she's feeling. And so definitely support. I can say get used to your home being colder, because they're gonna want that temperature a little bit lower to help ease those hot flashes and those other symptoms. And the popsicle is a good idea to offer that. Um, Probably one of the bigger issues is being able to talk about the sexual dysfunction. Partners may be uncomfortable with that, but it's important for people to be comfortable saying, hey, this is comfortable for me. And you try things like lubricants. Um, you can try things about like trying to get the mood or encouraging them to feel like they're still desired, to help keep the sexual activity going in your relationship.
Okay, so in the perimenopause phase, does the sexual desire change as well, or is that just leading up to the menopause as far as the symptomology side of it?
Um, It can. It can present in perimenopause. Perimenopausal women, because they are still experiencing the cycles, less likely to have complaints of the sexual dysfunction, but they will talk about those hot flashes. Because those can just come at any moment. So those wonderful handheld fans are a blessing. So those are nice to have on hand. Um, and even just being able to change some things to diet could definitely help.
Okay, so more of those lifestyle changes, and I think it's probably helpful or encouraging for um, him or any other male to assist our partner and, probably exercising with them, I guess, just
Yeah.
to assist them in building that compatibility for one, but also
Mhm.
just showing, or being attentive in the changes that are occurring
Yeah.
within the relationship, not just specifically with her, but
Mhm.
it can be unfamiliar territory. And speaking of the sexual side of things, like that's taboo in itself. Like people rarely talk about,
Yeah.
just to have a random discussion on sex, but now to talk about, hey, it's a change, it's a decrease,
Mhm.
and for him to understand that it's not personal towards him, it's just a change in her mood and her desires and or her physical change as far as the actual act. So no, I appreciate that insight.
Yeah.
Are there any groups or any other resources that families can have, whether that's the husband and or the woman for herself?
Yeah, there are definitely tons of support groups and like resources that you can find to help. There's a Menopause Society. There's a group called Red Hot Mamas. So I guess it's a on off of the hot flashes. And there's another group called Let's Talk Menopause, but there's tons, if not like hundreds of groups that are out there to offer support.
Okay, yeah. So that right there is enough insight too that people probably weren't even aware of, not just the
Mhm.
men. So I'm glad that it is some things out there that women can do. It's probably a lot of other forums too.
Yeah,
They can get certain information and see like, hey, I'm experiencing this. Let me make sure that,
yeah,
I'm not tripping.
yeah.
So how often within that menopause phase that women should, go to the primary care or I'm not sure the gynecologist maybe for that type of aspect. Now, is it any instance where the man can accompany the woman to these doctor's appointments and get insight as well?
Oh, absolutely. I can speak from like the primary care perspective, but just having the partner there, if they want information, I'm always open to it. To be able to explain things and with both people have the knowledge and the information on how they can go forward. But both are definitely welcome to come ask questions. I'm a paper person, so I love to give resources for people to take with them to be able to read and to review later. Um, and then there's a lot of things that may come up during the appointment that they may not, that the wife or the husband may not think of, that they can ask during the visit. Because the husband may say, well, my wife or the woman may not want to say, well, I'm having difficulty with intercourse, but the husband may bring it up and say, we haven't had intercourse, or she's complaining of vaginal dryness. Now that's something where it can now be addressed and hopefully get rectified to where now it changes their sexual relationship for the better.
I got you. So is there any, I guess, for the vaginal dryness, I'm sure that would not only impact her, she probably would view herself different. She probably want to engage different. But what are some tips that the partner, the man can do in that situation besides, like you mentioned, the lubricants, try to increase the mood around, leading up to a foreplay and all that stuff. But what are some additional things that he can do to prepare himself? Because it's probably going to be a shift. She's probably going to be embarrassed. She's probably going to be uncomfortable with the unknown. So, what are some things that he can look forward to and or do in addition to the lubricants or the mood?
And I think that comes in with helping support the recommended lifestyle changes without actually, like, maybe she won't really know that these are helping her with the exercise, with having a balanced diet, staying hydrated, getting sleep is very important. There are even phytoestrogens, which are mainly things like soybeans and like chickpeas. Those things can help increase your estrogen levels. So if he's like, oh, well, why don't you just have some of these, have some soy products, or why don't you have like these chickpeas? Not knowing that they're helping her to help increase her estrogen levels.
Got you. Yeah, that's a good tip. It's not, hey, let's introduce this thing in our diet, not knowing that it's, on the other
Yeah.
end. I got you. So with the mood changes though, how can he prepare himself? Because it's probably going to take a lot of patience on both sides, being that it is unfamiliar territory. But often, like the reaction is probably to snap back or get in your emotions as well and become cantankerous or combative. So, what are some tips for him to reduce those actions? And to just give exercise patience and grace with what she's dealing with, but not feel like he's been taken advantage of, because oftentimes that's what happens. All right, cool. I know you're going through that, but don't bring it here. Like you
Yeah.
want to, not be insensitive, but you also want to acknowledge that it is a transition. You might do have the mood change or the hormonal change. So what are some things or encouragement that you can give to the fellas who will potentially encounter those things?
So definitely, of course, you want to be understanding, but at the same time, it's important to make it clear that, hey, I support you and what you're going through, but at the same time, we still have to be accountable for our actions, things we say. So if you do say something that I find offensive or do something I find offensive, I'm gonna let you know. And I think that at a later time when you are in a different space, that we address it because it's gonna have to be rectified. And then if it's at a point where it seems like they're not really changing much, I definitely am big on even bringing it up to the primary care or even going to therapy.
Got you. Yeah. I mean, of course, I'm a advocate of therapy within those settings just to ensure that the emotional regulation is in tune for both parties involved, but also for him to acknowledge the fact that, hey, responding this way will
Yeah,
probably yield you better results and vice versa. And then, of course, talking to them as a unit, as a couple,
yeah.
and help them identify ways that their actions are impacting each other, especially during this difficult time. And the main thing too is letting them know that it is light on the other side, because like you said, it lasts for at least 7 to 10 years, maybe, depending on, her lifestyle, whatever the case is. So let's not let this moment impact, what can happen the next few years or whatever the
Yeah.
case is. So a random weird question. I know menopause is based on the cycle and all that, but is there an inverse for like males? Is there a male type of menopause or something that they go through within those?
Um, it's not really a male menopause, but it is possible as men age to have a lower testosterone level. Um, Quite often I've seen like erectile dysfunction where it's not anything physical, like nothing like a heart condition or any neurologic condition. It's usually to the body changing So it's not producing enough of that testosterone that's needed in order to maintain an erection or to have that sexual desire.
Definitely. So when I see a lot of different men, specifically the ones who are getting up there in age 40 plus, I do educate them on erectile dysfunction because naturally, just based on society, you're thinking like, it's, oh, I can still get hard, I can still perform, I'm not less or whatever. Like it's way more than that. It's a
Yeah,
mental side to it, it's also a physical side to it. It's some things that you can do from your diet,
yeah,
lifestyle changes, your rest. Because that testosterone is definitely one of those things that can be recovered and rebuilt, and a lot of people don't even view it as that.
yeah.
So there's a lot of modifications that he can do. So yeah, I just wanted to know was it a inverse or a different type? But yeah, if it's just low testosterone for males, then I definitely feel that I'd be on the right track with continuing to push that message. Um, is there any other tips that you want to give for the women and or for the men who are potentially about to hit this perimenopause or menopause phase? Like, is there anything else that you want to leave with them or suggestions?
I would say just talk. That's the biggest thing. If you're feeling something as a woman, say it. I feel this, I notice this, but also as the man, if you're noticing something, speak up. I noticed you started doing this. I noticed you started forgetting a lot, or I noticed that your mood seems to be changing, or that you are starting to have like sweating a lot more. Because sometimes a lot of women may not be aware of what's going on either. So just that communicating can help open everyone's eyes to what is going on, and then eventually like reach out for different resources that could be available.
I got you. Oh, so you saying it's not uncommon for her to be experiencing these feelings and not even know that she's going through. Okay.
Because you don't necessarily, I guess women don't necessarily think about it. And a lot of medical things aren't talked about amongst people or amongst families. They don't discuss their medical conditions. Or even just like things that are normal that kind of like go through it privately and you don't say anything. So a lot of people may not, or women may not be aware that, hey, I'm actually going through perimenopause, or, I did notice that my cycles have like decreased, which I feel like a man may notice like, hey, you didn't have your cycle this month, or you haven't had it in a couple months, So that's why I'm like, just that communicating. And then it leads the resource, like the pathway of being able to look things up and figure out what's going
Okay. So for a woman, let's just say a woman had a hysterectomy
on.
in a few years. Will she still experience menopause? Because from what I understand, if you have a hysterectomy, your cycle is gone, right? Or am
So
I?
your cycle will stop
Okay.
without the uterus. However, they typically, unless there's an issue, they leave the ovaries, and the ovaries are responsible for the hormones. So you can still go through menopause with the ovaries there.
Got you. See, you educated me on something. And I'm sure you educated on other people too, because let's just say a man or a husband is in that situation, like, babe, you had a hysterectomy. What do you mean you're going through menopause? They might not know that it's a difference between those things. So I just had to ask that. So, which is a good
Sure.
thing. Because what I want to do is ensure that I got well-rounded enough information so somebody can
Mhm.
come and say, all right, cool, let's check this out together, or for him to just take the initiative and potentially, flow through everything and say, all right, let me get, my questions answered and go from there.
Yeah.
Um, so speaking of getting questions answered and go from there, what is the preferred way for you want people to reach out to you if they have additional questions? Whether that's a woman soliciting for a primary care and or if it's a man who seen this video and say, hey, my wife is perimenopause or she's getting to the age, what can I do? Like, what's the best method for somebody to reach out to you and potentially book an appointment or at least do a consultation?
Absolutely. So I am employed through Secours. So you can go through their website, put in my name, Bridget Callaham, and you can also just schedule a new patient appointment. And I'd be happy to see you. I'm still taking new patients. So
Okay. Do you have a preferred email address as well? Because I can include that in the description and all that if they want to send it to you directly and probably get you to walk them through it or ask questions or whatever.
absolutely. That's so it's Callaham.md@gmail.com.
Okay, cool. Hey, listen, I appreciate you. Helpful insight. Lots of good questions, lots of detail that you provided. Anything else specifically you think they need to know before we wrap it up?
Um, Listen to your body. If it's something that you're not is new to you or you're not like familiar with, it's better to ask the question, find out what's going on, than to just suffer in silence.
Hey, cool. Appreciate it. And I would definitely catch you on the next one. Of
Absolutely. Thanks for having me.
course.